Hi everyone, I'm going to be presenting on my research addressing mental health support and literacy in the Bidi Bidi refugee settlement in Northern Uganda. So the civil war in South Sudan has triggered one of the worst refugee emergencies, displacing over 2.2 million people, and Uganda has experienced a rapid influx of these refugees, and the Bidi Bidi refugee settlement is the largest one as of 2020. There is an unfortunate prevalence of mental health issues and disorders seen in these refugees, and they're caused by a myriad of stressors like pre- and post-war trauma, poverty, and violence, and these lead to generally poor mental health and the presentation of mental illnesses in many. Mental health amidst South Sudanese refugees is in need of mitigative action, especially for children and youth. Without adequate resources for support and care in childhood and adolescence, the development of more severe disorders like PTSD or depression is inevitable. A review has shown that the social determinants of mental health issues are being tackled in the existing infrastructure, but there is a need to focus on mental health literacy, without which many refugees fail to seek mental health care in the first place. So an effective strategy for mental health intervention in this community would be to target children and youth through mental health literacy in order to mitigate their mental health symptoms that could potentially evolve into more severe challenges as they grow into adulthood. Research is necessary to inform the effectiveness and validation of subsequent interventions that we develop, as we need to sensitize these to the specific community needs and cultural beliefs. Primary data collection will be conducted at Bidi Bidi by our research expedition team. Key informant interviews will be conducted to gather information about attitudes toward mental health, and we will be conducting focus group discussions to investigate the roles of teachers in understanding and contributing to the mental health of students. We will also be administering questionnaires to examine the levels of mental health literacy and the states of mental health using screening tools that are appropriate to the respective age groups, like the GAD-7 or the PHQ-A. A systematic review has been conducted to understand the existing mental health issues, resources, and literacy in Northern Uganda. One of the perceived causes of the high incidence of poor mental health is the low level of mental health literacy. So this research will reveal the gaps in mental health support and literacy, which will then allow a mental health literacy curriculum to be devised with topics that are tailored to the gaps that have been identified, and they'll establish common ground between cultural beliefs and evidence-based information. This intervention will empower children and youth to create a mental health literate generation that will see improvement in general mental health, hence curbing the effects of debilitating mental health issues that would otherwise prevent them from achieving their potentials. Please contact me at deadev@gmail.com if you have any questions or points for discussion. I would love to hear them. Thank you.